So welcome to your next chapter. We are a production of The Heights at Avery Heights. I'm Saban Sefarelli, and I'm the Senior Living Specialist. I'm talking to Katie today. Welcome, Katie.
Thank you for having me.
Katie is from Tucked In Elder Care, which is an awesome organization. I myself have had the great pleasure of working with you on a pretty challenging client, and you did an amazing job. And so that's why I wanted to have you here today. And we're really going to be talking a lot about the importance of asking for help. And what better person to ask for help than a senior living specialist like yourself? Tell me about Tucked In Elder Care.
Sure. So Tucked In Elder Care is a geriatric care management company. It was founded by a woman named Erin Lynch, who is a gerontologist. She's also a licensed nursing home administrator, and she was living on Nantucket, and she was managing the nursing home on the island and realized there was a great need for care management services. So they would be discharging clients home and there wouldn't be enough services and they would end up back, and it was just a cycle. And she realized that there needed to be more options for people on Nantucket. So she reached out to her former colleague, Kevin Smith, who owns Best of Care, which is a home care agency in Boston, and asked if he would be interested in partnering with her. And she was able to start Tucked In Elder Care. And she's grown the company across Massachusetts. I'm in Western Mass and in Northern Connecticut helping clients, and they're still growing throughout New England. So yeah, it's wonderful. So we're affiliated with Best of Care as well as Assisted Living Locators, which I also manage, as well as Moving Mentor, which is a transition moving company that helps with downsizing, organizing, and moving for seniors specifically.
Nice, very nice. So I love that. I love when it's kind of like us. We're a CCRC, continuing care, retirement community. We've got it all under one roof in terms of independent assisted memory care. And then we have our skilled offering as well. And that just makes it easier for people. There's so many communications and conversations that need to go on. And it sounds like you've got a nice streamline of products. And the more you have, and the more you guys are communicating, that's the key. So the people, it's so hard to have to keep telling the story,
Exactly.
So, yeah, that's great. That's great.
Exactly. Yeah.
Tell me about the services. Tell me about the services for
Sure. So it's kind of hard to explain what care management is and geriatric care management is, because it's kind of a lot of everything, and it's different for each client. So we usually say, ask us what you need and we'll tell you if we can do it. we usually try to figure out if we can't, we'll do whatever we can to at least provide the resources to be able to help the client. But our main services that we do offer is care coordination, whether it's crisis driven, somebody is in the hospital and they need next steps. They need to know what their options are, what they're going to do, what their home care plan looks like, if they're going to transition to a different level of care, those sort of things. Long and short term. We can help with transportation to appointments, coordinating those things, scheduling things for clients, talking to insurance companies, things like that. Also health and wellness. So I'm not a nurse, but I'm a gerontologist and I focus more on the social aspect of it, but we do have nurses on staff. So if there is medication reviews, things like that, we can have those done as well. Also safety. So we do home health safety assessments, making sure homes are safe for the clients. We can recommend durable medical equipment. We can help coordinate installation of those things, all of that. Again, discharge planning, as well as transition management, advocacy and support for clients. So somebody who doesn't maybe necessarily have a family or friends or a social support system to help them kind of be an advocate for them, and also provide resources, because we have trusted community partners such as you guys at Avery Heights and other multiple resources available, so we can refer to other agencies as necessary. And we're also well informed on social, federal, local programs and resources that people may also qualify for if they're veterans or if they need to go on Medicaid down the line, things like that.
Oh, wow. Very nice. Yeah. And that's, one of the key things you said is that people that don't have anyone, I mean, that's really where your services, I think, are invaluable, because there is a lot. I mean, you get in your 90s and 100 and so forth. Unfortunately, a lot of people outlive their kids. Obviously, sometimes, their sisters and brothers and stuff like that. And you get to a point where there isn't anyone to help you.
Mm,
As an older
exactly.
adult, you need that. You need the help. You need the advocacy. I think it's important. But also on the flip side, working with families is also important, because a lot of times they don't know what they're doing. They don't
Exactly.
know, it's unfortunate that it's fortunate that we work in an industry that is to help people, to help older adults. It's unfortunate that it's an industry where you could make a substantial amount of money, and
Yeah.
therefore a lot of people take advantage of that.
Exactly.
And it can be sad to see. Unfortunately,
Yeah.
we get a lot of folks that come in for tours that have just been through the ringer with many different, everything, taking advantage of them and not giving them the real information, especially veterans. I mean, there's
Exactly.
veterans benefits out there, and I don't know how many people I sit with and they have no idea.
No idea. Yeah, exactly.
Yeah.
I'm always, that's one of the first questions I ask. Have you spoken with an attorney? Have you, do you have your paperwork in place? Are you a veteran? Sort of things. First things first, because we want to make sure that they know what they're entitled to.
Yeah,
absolutely.
And that's very important. And the paperwork too, like you said.
Exactly. And the system is so convoluted and so confusing, even to us. We're professionals, we do this every day. And sometimes I'm like, I don't know where to go with this, but we do our best to learn and find resources that can help explain it to us and to be able to explain it to our clients and things like that. So it's it can be completely overwhelming, especially if you have no idea where to start.
Yeah, exactly. I totally agree. So what I love is, I'm going to read a little bit. You have a list of questions that if people answer yes to on your website. So I read them through and they're awesome. Who is your ideal client? And how can that ideal client benefit from your services? We touched upon that a little bit, but I think it's important to talk about.
Like you said, I think a lot of my clientele is aging solo agers, so people who don't have that support system, who just need somebody to be there to help them, because they're not able to help themselves the same way they used to be. But as you age, things get more difficult to be an oversight, to be an advocate. A lot of my clients are also the families, the children, the nieces, the nephews that have realized, oh, mom's not doing great, or auntie's not doing great, and now where do we go? What are our options? Where do we start? So again, like we said, as I said at the beginning, it's ask us, what you need, and we'll try to help you get there in whatever way we can. So, any really senior who could use a little extra support or security.
Yeah. I can imagine. It's funny. We do run into a lot where it's that nephew niece kind of situation. And I adore my nephew. Let me just say that flat out. Actually, both my nephews, I adore them, but it's just got to be so awkward. I mean, it's not, I love them, but it's kind of like, and I know them and I've known them since they were babies, but to now be like relying on them care is just, it's awkward. I know a lot of times I always hear, oh, I don't want to ask them. Oh, I don't want to bother them too much. And I can imagine I can see myself being the same way. So an organization like yours where I'm paying you, so I'm going to ask you a ton of things.
Exactly.
A lot, it's a lot more comfortable.
Exactly. And we also do, some family mediation to some degree, where if not everybody's on board, I'm happy to sit down with the families and kind of talk about, what their options are and how I'm there to support them and ways like that. Because half the time, maybe one child is on board to make a move or to get services in place, and the other child, no, mom's fine, she's fine, and so like, can you come in and talk with us and kind of sit down and explain this, so that happens a lot as well.
That's the hardest as well, because a lot of times mom or dad should have moved a while ago, and that one person sometimes is the POA or something, that someone, a power of attorney, someone who can sign that paperwork. And then, then there's that rush to make it happen. And inevitably, a lot of times that person's always like, oh, I wish I had done it sooner.
And there's guilt behind it. Nobody really wants to necessarily move into an assisted living or a nursing home and things like that. But, you know, once they see the value and, you know, how great it can be, it's,
Yeah,
obviously I'm a huge advocate for community living, and I think
yeah,
it's
yeah.
so important for socialization and things like
Yes.
that.
Yep.
But yeah, you know, it gets to the point, let's talk about the benefits and how your life can improve
Yep.
by making these changes, and
Yep.
even adding home care services, somebody to help you with the laundry and
Yep.
run your errands for you, so you're
Yep.
you're safe, but you have everything you need. You're getting nutritious food, and you're clean and you're safe. So it really is just a matter of getting everybody on the same page
I
to move
agree.
forward.
And there's always that giving it a try too.
Mhm.
We always
Yeah.
offer that trial,
Yep.
you know, kind of
Yes.
situation where we
Which
furnish
is
the
wonderful.
apartment, and that just always feels better to people. You're not selling the house right this minute,
Yep.
and you know, you're just going to try it out. And that,
Yeah.
I think is important. My big thing when I do tours, it's like, this is a big decision.
Hmm.
Not rushing anybody through it or towards it. And that way, when the decision is made, it's a healthy decision. It's
Yep.
a decision. There's no,
Mhm.
like you said, regrets and things like
Yeah.
that. So
Exactly.
it's important to slow things down. So what is the process? What is take me through when someone signs up for your company, and
Sure.
what do you do with them? What's that onboarding situation?
So usually it's a referral from another professional or something, or sometimes the family reaches out directly, but they can go to the website, which is tuckedineldercare.com. There's our contact information for the owner, Aaron, and my email's on there. All of our contact information is on there. And we do an initial consultation. So it's typically virtual, sometimes in person, depending on what the situation is, to learn a little bit more about the client's needs and see if it's something that we think we can help with. Then we would send along the paperwork and get them enrolled in our program. We also use we're probably going to be upgrading it, but right now we use a care management system, which you know, doctors can have access to, the families can have access to all of the notes. It's a good way to keep in constant communication about clients if they need that. So families can access it at any time as well, and the clients can
Nice.
access it.
Very
So
nice.
it's a great option. So the process is easy, and we try to make it, you know, as individualized and streamlined as possible. Because if we can help in any way, we will. And, you know, we work with our clients in different ways, however they see fit. And with our billing, we try to, you know, we're very upfront about it and things like that. If I'm going to be doing time, you know, I'm going to let them know in advance that I'm going to be doing this and the estimated costs and things like that. So we understand that it's you know, it can be an expensive thing to have a care manager on board, but we don't overutilize. We just do what we have to do to help the client and as necessary.
So a few things on that. First of all, like when you say it's expensive, and here's the thing, I was fortunate enough to I had a care manager as well for my mom. And there was a big difference between when I didn't and I did. And it actually saved me money. So
Yeah.
it is maybe expensive or an expense,
Yeah.
but like we're talking about asking for help, having the right people in place to help you is going to save you money, because you honestly you end up spending more money. I mean,
Exactly.
it took me so long to get my mother in the right place for her, and once she was in the right place, it was easy breezy, it was smooth.
Yeah.
But when she wasn't, and that was because I was making the decisions, and I've been in this industry for almost 15, 16 years now. So now my decisions are obviously would be more educated. But back then I didn't, I was just like everybody else. I had no idea. And I made some bad decisions. It affected me financially, emotionally, mentally. It was, so when you look at the expense, it is worth it. Yes, it feels like you're putting, but it saves you money and time. Wasting.
Exactly.
I put my mother in two different places, which were just wrong for her.
Yeah.
And that cost me money and moving and mental anguish for her and me.
Exactly.
And the whole thing. If I'd done it all over again, I would have definitely reached out to a company like yours and said, hey, this is what's going on. What do I do? Like you said, there are different levels that people can work with you. I'm sure they can just call you and ask you that question.
Absolutely.
Answer that question. You have the business relationship, and that's it. You don't have to necessarily have you hold the person's hand, which is great. It might just be, hey, what should I do?
Yeah, exactly. And we try to create a roadmap. We try to create a roadmap that the client can utilize without us being involved. So if we do a care plan, I have all the resources available, all the contact information they
That's
need, all that
perfect.
information. You can take this and you can use it, and that's your
Yep.
tool to use. If you need my assistance moving forward, I'm here.
Yep.
So that's sort of the
Very
whole point
valuable,
of
very
it. Yeah,
valuable.
exactly.
I mean, so the other thing on expense, do you take long-term care? And I know that in insurance itself, I think there's some elements. So talk about that a little bit.
So there are some ways, it's mostly private pay, but there is some long-term care insurance policies will cover geriatric care management services. We also do long-term care policy reviews as part of our services. So if you have a policy, and they're usually very complicated and confusing, and there's elimination periods and this and that, we can help review those and, help you get the best benefit of it. So occasionally they will reimburse for care management services, but it really all depends on the policy. Otherwise it's mainly a private pay situation.
Yeah, so it's always good, even with the long-term care policies, ask questions, because a lot of times people don't utilize those policies to the
Exactly.
depth
No, not at all. And they've been
Yeah.
paying for them and they're expensive, and
Yeah.
to know when it's time to put it in force and to start the elimination period and to get the assessment going and
Yep.
and all of that stuff. It's, people wait too long and then they don't get the full benefit
Yeah,
from it.
so because that's expensive to pay into.
Yeah,
And
exactly.
use it. It's again very valuable to have. I mean, when people say they have long-term care policies, we actually have balloons and streamers.
Yeah, it's true.
Fall
Yeah,
from the ceiling. It's like, because
I'm like, that's good. I'm so happy for you, because
Yeah.
it's really help
Yeah.
cover the cost
Yeah.
of
Yeah.
quality care.
Yes, agreed. So you talked a little bit about gerontologists and geriatric care manager, and then I know we've talked about, I know it's like that senior living advocate kind of runs in there. Tell me, define each one of those
Sure.
if you can, and then let's talk about why we've talked about why it's important for an older adult to have an advocate already, but talk about each one of those, define those roles.
Sure.
We throw around these words.
Yeah, exactly.
What?
So a gerontologist is somebody who has studied gerontology, which is the management of aging services. So I have my master's in gerontology. So basically I'm a gerontologist now, but it really just means that I understand the management of aging services, whether it be assisted living, independent living, nursing home care, all the different aspects of senior care. So that's just like a
Which is
designation.
important. I feel like you're going, whatever, I did that.
Yeah, no,
Many of the people that are listening to this don't have all that
Yeah, well, I love it. And then as a geriatric care manager, which is also known as an aging life care manager, they're simultaneous, they can, be interchanged. Though that is the specific role where we help kind of put all the pieces together. We do the care management pieces like that. There's also a senior advisor, which can kind of do the same thing. And that's sort of my role with assisted living locators, where I help people find different community living options. And then as a senior advocate, there are different companies that are, there's a nurse advocate, who's a nurse who helps more with the clinical piece, who helps at the hospitals, who helps with all of those sort of things. I don't do so much of the clinical piece. I'm more of the social model, but I have the clinical understanding to, refer that way.
Nice.
But so basically I advocate. So even just an example, I had a client who ended up in a hospital in a different part of the state because they were visiting a family member. Their daughter wanted him closer to home to rehab, but the hospital was like, I'm just going to send it to the people I always send it to, and I'm not going to worry about it. And he's going to rehab 2 hours away from you.
Wow.
For the next couple of weeks. And that's okay. But she called me and I said, no, like they can send these referrals to these places closer. And we got him right down the road, and now he's there, and hopefully, he does well. But it makes it so much more, but she wasn't going to be able, she didn't know to advocate for herself. And he had to keep pushing. I sent email after email. I made phone call after phone call, because this is a quick process. So kind of to help her get that process, but now he's there, and it's much more convenient for her, and hopefully we can, continue his care beyond that. But that's just an example of how you need an advocate or to advocate for yourself.
And that's a great example. And that's a great example of an isolated kind of situation where you can come in and help. It doesn't have to be a full-blown thing. And it floors me as well when people don't realize that they can, have referrals. They don't just have to go to where the hospital says. And not only that, it's like, if you're in a place, rehab, that you don't like, person can move.
Yeah.
These are all the things that I don't think people understand. And you
And
don't,
it's like jumping through hoops. They make it difficult.
yeah.
So, you know, to have
And you
somebody to
don't
kind of
always
help.
have to use, when you have these companies that, which is great, the whole umbrella, you don't
Yeah.
always have to use what's in that umbrella. You can use
Exactly.
something
You have the
else.
right to choose. Clients
Right.
or
And
patients have
sometimes
the right
that's
to
not,
choose.
yeah. I know that for myself, I was with my mom, the place where she was, she ended up going on hospice. And when they put her on hospice, they were like, you know, we're going to use this company. And I was just like, well, tell
Yeah.
me about that company. You know, it's like,
Yeah.
you know, I was in the industry by then, so I knew,
Yeah.
like, yes, tell me some information. You know, you can't just choose a company for me. I have a
Yeah.
right to vet these people out, have conversations. You know, I don't have to just go along with the flow. And I think,
And they can make recommendations, and I'm sure they have good relationships and things like that. And it's
yeah,
easier and things, but
right,
it might not necessarily always be the right thing. So definitely,
exactly.
I always give options too. And with if there are options, I'm giving at least 2 or 3 different
Yes,
choices
I
for
like that.
everything that I refer.
Yep.
You make that decision, but these are the ones that I would recommend that you reach
Yeah.
out to. And I can help them make that decision, but it's my job to give them those resources
Yep.
to
I
choose
like that.
themselves.
Yep, that's very, very important. So do you have any advice that you can kind of give our caregivers that are out there?
Yeah, you know, take your time, take your respite,
Mhm.
take care of yourself. And
Yes.
there's so many, especially like with people caring for their loved ones who have memory loss or dementia, that is so taxing on the family members and the caregivers. And it's a nonstop 24-hour job, along with most of them are working, have their own families, they're in the sandwich generation, all of that stuff. But to make sure you take the time to care for yourself, and there are resources available, like you said, you guys offer short-term respite stays
Yeah.
for
Yep.
residents. So if you want to go on vacation, you're a caregiver, you want to go on vacation, but you can't leave mom because she's not going to be okay. There's options for
Yeah.
her, like a community like Avery Heights, where she could stay there for a couple of weeks or
Yep.
a month.
Yeah.
And even a lot of insurance companies will help pay for respite options, caregivers to come in the home. Contact your local aging service access point, which is like
Yep.
the local
Area
senior
agency.
services,
Yes.
basically.
It's a mouthful. Area aging.
No.
Agency on aging.
Exactly, aging service access point. But call them, and they
Yep.
have so many resources as well, and they can help with caregiver support. I actually partner with some local ASAPs, aging service access points,
Yep.
and provide caregiver support. So if a client is overwhelmed, they're taking care of their parents, they'll call me and I'll work with the caregiver to say, these are your options. This is the things you can do to give yourself a break, and give you some information and some support. So
That's the
it's
best
really,
advice. And I know the Alzheimer's Association also has some funds for respite.
yeah,
If you can't afford
yeah,
that week or 2 weeks or that month,
yeah.
there are some funds that are available. And long-term care policies also
Oh
have
yeah,
funds in
absolutely.
there for respite. So if you're doing that care at home, you can get that respite as well. So
Exactly.
there's all sorts of, but you're right, it's so important. I was just talking to a young lady this morning who's actually getting married in September.
Yeah.
Days on Monday. She's trying to get, dad's in rehab, mom is at home by herself. She's trying to kind of take care of herself.
Yeah.
Not even looking forward to her birthday. I said, listen, your birthday comes
Oh,
a year.
yeah.
Take a minute. Just
Yeah.
go outside and just take a minute for yourself.
Yeah.
It's important. It's important not to get so caught up in a few different things. I know I did it, caught up in being, you know, Superwoman or Wonder Woman. You know, I've got it. I'm going to help, you know, the guilt trip, the shame, you know, don't get caught up in that. And don't get caught up in just, you know, trying to do it all everything yourself.
Yeah.
You know, don't get caught up in that because
Like you said, ask for help. Ask for
yeah.
help. There's
Ask
help
family
available.
members too.
Yeah.
And it
Exactly.
sounds like you can help with that. There, a lot of times, you know, this young lady, it's just her. She's got siblings, but the siblings aren't really helping. And
Yeah.
it sounds like you can kind of get involved there and kind of say, hey, you know, you need
Yeah.
to do this, you do, you know, kind of.
Yeah. Can you take on this for me? I need you to take
Yeah.
on this role and
Yeah.
this responsibility.
Yeah.
Exactly. And you know, it might not always be the easiest conversation, but you
Yeah.
can't take care of somebody else if you're not taking care of yourself.
Exactly, exactly. So forgive the vacuum in the background.
Oh yeah.
This
I
gives
can't
me
hear
an
it.
opportunity to self-promote here. We are renovating. So we're renovating the whole front of our building. We've got quite a few apartments that we're updating and renovating. So lots going
Wonderful.
on here with the vacuums, and it's
Yeah, good.
exciting,
It's
actually.
exciting
Yeah,
stuff.
yeah,
It's
yeah.
already a beautiful community,
Yes.
so even
September,
maybe-
October, we will have a little bit of a facelift. And it is, it's so funny. When I tour people, I said, hey, we're gonna be renovating. They're like, what are you renovating?
Why? Yeah, it's already very
Like,
nice. So.
you know, you keep up with the
Yeah.
times.
Yeah, exactly.
So how can we get in touch with you? How can we?
Sure. Yeah, you can reach me. My phone number 413-329-6730. You can go to tuckedineldercare.com.
Yep.
My email is katyk@tuckedineldercare.com as well.
Nice.
Yeah, I'm on LinkedIn, we're on Facebook. So anyway.
Yeah, well, we'll definitely be reaching out. Thank everyone for joining us for
Thank you.
this chapter, and we'll see you real soon. Thank you.
Thank you so much. We'll see you soon.